Good evening, everyone, and welcome. My name is CJ Walker, and I'm so glad that you're joining us for another session in our Type 1 Diabetes Screening Series, a program which is designed to help families and individuals understand the process, emotions, and the next steps for follow screening for Type 1 diabetes. Tonight's session is titled Life After Type 1 Diabetes Screening: The Benefits of Lifestyle Interventions. After a positive screen, one of the most common questions people ask, can lifestyle really make a difference? This discussion explores exactly that, what healthy habits could do and what they can't within the bigger picture of type 1 diabetes risk. So here at Diabetes Sisters, our mission is to support and empower women living with all types of diabetes through education, resources, and community. So tonight's conversation focuses on how lifestyle choices from nutrition and movement to stress management can help you feel proactive and supported during this monitoring phase. We're honored to be joined by Dr. Victoria Buhari, who you may recognize from earlier sessions in this series. Dr. Buhari is a certified in endocrinology, diabetes, and metabolism, as well as lifestyle and obesity medicine. She's the founder and CEO of Paris Wellness and Diabetes Center and serves on the board of directors for Diabetes Sisters. Her expertise connects medical knowledge with real-world strategies that empower patients to take meaningful steps toward better health. We're also thrilled to welcome Jennifer Rollins. Jennifer is a registered dietitian and certified diabetes care and education specialist with a master's degree in human nutrition from Winthrop University. She spent 15 years with Atrium Health as a diabetes educator before founding her own private practice, my RDN coach, where she helps clients build sustainable nutrition and wellness habits. Jennifer is passionate about making evidence-based nutrition guidance and practical, accessible, and empowering patients. And finally, we are joined by Tanya McNeil, who will share her lived experience after screening positive for type 1 diabetes. Tanya's story brings a personal perspective to tonight's discussion: what it's like to navigate lifestyle changes after screening, the emotions that come with it, and how she's learned to balance awareness with self-compassion. Before we begin, we are going to go over some housekeeping notes. So feel free to use the Q&A box throughout the presentation. We'll answer as many questions as possible near the end. Tonight's webinar is being recorded and the replay will be available at diabetessisters.org. And most importantly, this is a safe and supportive space. No question is too small and no experience is too unique. So thank you again for joining us. Now it is my pleasure to turn things over to Dr. Buhari, who will start us off with an overview of how lifestyle interventions can support health and balance after screening for positive for type 1 diabetes.
Thank you so much, CJ. Can everybody see the screen from your end? Just to make sure. Perfect. All right. Well, thank you again. And I'm really excited to talk about how lifestyle can affect type 1 diabetes and how this looks like when we talk about screening for type 1. So a brief overview in terms of what type 1 diabetes is. This is an autoimmune condition, and essentially what that means is your body is essentially attacking itself. So autoimmunity means your body attacks itself. And in type 1 diabetes, it attacks cells within the pancreas, specifically the beta cells. And these beta cells produce insulin. Insulin is important because it regulates blood sugar levels. So if you don't have enough insulin, your blood sugar levels can rise dangerously high, and it can result in a condition called diabetic ketoacidosis, which is unfortunately life-threatening. When it comes to type 1 diabetes, we know that living with type 1 diabetes presents itself with multiple daily demands, and that goes from constant monitoring, be it finger sticks or continuous glucose monitoring, having a team support, healthcare providers that you trust, that are reliable, that listens to you, etc. What do you do around exercise and how you balance your meals, what proteins do for you, what different carbs do for you. Insulin use, what is covered? Are you going to use a pump? injections, being tied to giving yourself insulin and really trying to figure things out, making sure your blood sugar levels are leveled out throughout the day. And of course, emotional struggles. We know that type 1 diabetes is highly tied to depression and also something called diabetes distress. We also know that if you have a family history of type 1 diabetes, you have a greater risk of developing type 1. And that can be up to 30% if both parents have type 1 diabetes. And then if you have a father with type 1 diabetes, that has a higher risk than a mother. So there's an increased risk of developing type 1 diabetes if there's a family member with type 1. But we also know that over 85% of people who develop type 1 actually do not have this family history of type 1 diabetes. So it's very important that there is an awareness of type 1 diabetes because the majority of people who are first diagnosed with the condition presents with no family history. And then more importantly, that life-threatening condition, which I mentioned earlier, which is diabetic ketoacidosis, you have about 40% who present in diabetic ketoacidosis at the time of diagnosis of type 1 diabetes. We always thought that when we diagnosed type 1 diabetes, that was essentially it. You know, people come with high blood sugars, they come with the clinical signs of diabetes, and they're diagnosed with type 1. But what we now know is that type 1 actually is present months to years before the typical signs and symptoms that we're used to seeing. In stage 1 type 1 diabetes, you have the presence of two autoantibodies. Those proteins that I mentioned attack the pancreas, but there are no elevations in your blood sugar levels, and there are no signs and symptoms of diabetes. And then in stage 2, again, you have two autoantibodies present, but this time your blood sugars are mildly elevated, but you do not have any clinical signs of type 1 diabetes. And then finally, your stage 3 is also called the clinical type 1, where you have your typical signs and symptoms of diabetes and also your elevated blood sugar levels. So you might wonder, why are we even doing this in the first place? Why is screening important? And number one, we want to prevent hospitalization. Once you're screened, and if you're found to be have type 1, so that could be the earlier stages, stage 1 or stage 2, then we monitor you. So you could be prepared. You know, you can figure out what type of blood sugar monitoring you want to do. Is it finger sticks? Is it continuous glucose monitoring? You have time to prepare when it comes to insulin administration. Do you want to use pens or do you want to use pumps? And if it's pumps, you have time to actually research the different types of pumps. You have the ability to undergo clinical studies. There are many studies that are currently in place where they have different criteria to either prevent the progression of stage 3 type 1 diabetes or trying to see if they can preserve some of those beta cells. And also the option for early treatment. And teplizumab is one of the is actually the only medication that has been approved currently for people who are in stage 2 type 1 diabetes and really helps to prevent the progression to stage 3. And then, of course, if you screen early and you're monitored, we can reduce the risk of developing diabetic ketoacidosis. And if you remember, I mentioned that 40% of people who are diagnosed with type 1 diabetes have are in diabetic ketoacidosis, but if actually being monitored, that risk decreases down to 5%. There are many ways in which you can screen for type 1 diabetes. The lowest hanging fruit is really checking these autoantibodies, and there are four that the American Diabetes Association recommends, and this can be done in various ways. You can do it through research. The Ask and TrialNet are two research programs that you can test for those autoantibodies. There are also some state-based programs, and these state-based programs can be done from the newborn screening all the way up to various ages, depending on their particular criteria. Other avenues for testing is Enable Biosciences. And Enable Biosciences, your provider will actually get the kits from this organization. It'll go directly to the clinic, and then your provider will give the kit to you. It can be done in the office, or you can take it home and do it through a finger stick. And then LabCorp, Mayo, and Quest are your typical places where you get your annual labs, etc. So your provider will write an order for those antibodies that I showed prior, and you go to those labs and get it done. Ask and TrialNets do have the options of you getting going to a local lab, or Ask also can mail you a home kit. So what happens if you test positive? And we look at multiple things. First of all, first thing we look at is are there how many antibodies are positive, and is if there's a family history, and it really helps us to see what stage you're in. But what we do all the time is we will always regularly check your metabolic health. We're also, as I mentioned prior, help you with knowledge, equip you with the information that you need in order to know what type 1 is, what the signs and symptoms of diabetic ketoacidosis, with the aim of preventing you from getting into diabetic ketoacidosis. And then, of course, we look at treatment options, what happens if there's any potential emergencies, and other research opportunities that I mentioned prior. Teplizumab is the medication I mentioned earlier that was FDA approved in November 2022 as the first medication to really help delay the progression from stage 2 type 1 diabetes to stage 3. And currently is approved for children who are 8 and above. Presents basically the way it's administered is a daily infusion for 14 days. There are many things in terms of lifestyle. This is a question that we're asked frequently. And what can we do when it comes to lifestyle interventions? And I'm very happy that we have Jennifer here to talk to us about lifestyle interventions when it comes to improving the metabolic health and preserving beta cell function. So Jennifer, I'll turn it over to you.
Okay, great. Thank you, Dr. Buhari. So, as we look at other ways to delay type 1 diabetes onset, we want to really look at what can we do to preserve beta cell function, improve metabolic health, such as blood pressure, cholesterol, weight. How do we reduce complications or the risk of DKA, diabetic ketoacidosis? And how do we improve the quality of life for those that are at risk? Next slide, please. So dietary and nutrition interventions, they can definitely help in managing diabetes before it's onset into type 1. And we know, currently what the guidelines show of diets that are high in sugars, saturated fats. We know these are actually associated with increased risk of insulin resistance and can promote inflammation. And this has also been shown to put stress on the beta cells and can further cause loss of the beta cells. So adolescents in one study who were consuming diets rich in sugary beverages, processed foods full of sugar, and high-fat snacks actually faced an increased risk of metabolic imbalances. And this was known to contribute to higher blood sugars and inflammation. And one observational study shows that children had a higher, or who followed the Mediterranean style diet, had a higher intake of fruits, vegetables, whole grains, had actually reduced markers of inflammation and better glucose control. So the evidence that we look at, we want to see, well, what stabilizes blood sugars, what promotes our body to use our insulin more efficiently or become insulin sensitive, and what reduces inflammation to preserve beta cell function. And so if we look at what's listed here, a lot of these components are actually part of the Mediterranean style diet. So lower glycemic index foods, these are things such as whole grains, legumes, vegetables can definitely prevent rapid blood sugar rise and reduce the need for insulin. We look at plant-based foods, which are these things just mentioned, and lower glycemic index fruits and nuts and seeds have been linked to lower inflammation and improved insulin sensitivity. And then we see anti-inflammatory foods actually combine all the foods we've just listed, but specifically leafy greens, berries, nuts, and seeds that are high in omega-3s and antioxidants and something called phytonutrients. So loaded with nutrition and vitamins and minerals are effective in reducing inflammation, which again, we know can preserve beta cell function. Dietary fiber are found in these foods, and specifically fruits such as berries, apples, pears, guava, for an example. Oats that are high in fiber have been shown to regulate blood sugar and slow the digestion of carbohydrate, and thus leading to more insulin sensitive. Fiber can also support our gut health, which gut health has been researched in the role in autoimmune diseases and many other diseases. And gut health can influence inflammation, our immune response, because we know 80% of our immune system is in our gut. So when we consume foods listed above that are part of the Mediterranean diet, we're actually promoting good gut health and reducing our risk of autoimmune diseases such as type 1 diabetes. Next slide. And if we look at specific nutrients and what has been linked to the role in insulin sensitivity and inflammation, and what may be vital as starting someone who is at risk on, is looking at vitamin D levels. Many people are already vitamin D deficient, and vitamin D plays a role in our immune function and our insulin function, so insulin sensitivity. We want to be sensitive to our insulin where our body uses it more efficiently to prevent diseases. So current evidence does support an association with those that are vitamin D deficient as having an increased risk of autoimmune diseases, possibly such as type 1 diabetes. However, a definitive relationship has not been established. Further research is needed. Magnesium is another mineral that is essential in glucose metabolism and insulin action time, and supplementation has been associated with improved insulin sensitivity. So it has been recommended to be strongly considered in those that are at risk or those with poor metabolic health. And of course, we know physical activity can be a big component to lifestyle. And when we look at physical activity, we already know there's a lot of well-documented research for its improvement on insulin sensitivity, glucose metabolism, and supporting overall metabolic health. Exercise helps our muscles to utilize glucose or blood sugar and reduces our need for insulin and can preserve beta cell function long term. So aerobic exercise, specifically walking, after meals has been shown to be effective in reducing our blood sugars after a meal. And this is by means of our muscles contracting as we walk, and it helps the glucose to be taken up by our muscles to actually do the walking. Studies indicate also that light to even moderate intensity walking for just 15 to 30 minutes after meals can significantly reduce blood sugar spikes. So regular walking is highly recommended as something to start right away. And then resistance training is another one that is often overlooked. But resistance training can be lifting weights, exercise bands, using body weight exercises, dumbbells, or even specific classes that focus on building muscle mass, because we know muscle mass helps really uptake glucose or blood sugars from the bloodstream and help it be used in the cells. And so this long-term can also help the body stay sensitive to insulin. There are a few other lifestyle factors as well. People are always asking about stress and sleep, and these, of course, are essential for metabolic health. We know chronic stress, poor sleep quality, it can be detrimental to our health as it can raise cortisol, which is the stress hormone, which in turn can raise blood sugars and, of course, put extra wear and tear on the beta cells.
Thank you so much, Jennifer, for that.
Yep.
At diabetessisters.org, there's a lot of information available when it comes to screening for type 1 diabetes. So please visit our website. And truly, the fact that you're here gaining this knowledge and information, it really serves as an empowerment for you and your loved one in order to help screen for type 1. And if positive, on the website helps to give you directions in terms of what you can do next. There's webinars that we have present. Type 1 screening streamline really goes into detail in terms of what screening is, how you can be screened, and what to do afterwards. There are also a lot of PDF downloadable files that are available as resources, some that you can give to your healthcare provider. So by all means, go to the website, check out all the resources, and also there are links available to the places that I mentioned where you also can be screened. I'm going to stop the webinar now. All right, and hand it over to CJ.
Thank you so much for setting the stage so clearly. And we are now entering the discussion and Q&A phase. So, what's going to happen? We're going to move on to the Q&A portion. So, thank you everyone who's been submitting questions. And now we are going to ask the speaker some of those questions. And the first one is, how can parents encourage healthy habits without adding pressure?
Oh, I get this a lot. This is a great question. As if anyone is a parent, they know they are always wanting their kids to make healthy choices without being nagging or putting pressure on them. So, what I generally recommend parents do, and this can work with kids of all ages, is really lead by example first. So, if you are leading a healthy lifestyle, kids, children, even teenagers tend to really see what we're doing more than what we're telling them to do. So they are watching. So really be a role model, right? Try to live an active lifestyle, have activities the family enjoys doing. And then also around food, right? They are looking at what choices we're making, what we're saying about food, what we think about food. So involving kids as much as we can mean taking them to the grocery store, taking them to a farmer's market, helping them make a choice. If they're younger, just give them two options where they have a healthy choice to pick from. Getting them involved as much as possible is also important at every age. And then we know there's a lot of strong research on eating together as a family. So, again, not putting pressure on kids at the dinner table, but having it be a safe place where anything goes and questions can be asked, but healthy food is provided where they have the ability to make that choice themselves.
Excellent. Thank you so much. Our next question, what's one piece of advice you give to someone entering the monitoring phase?
So I guess I can go ahead and try to answer that. For me, I was able to do the Tziel infusion. And so after the 14 days of the infusion, and I've gone back to see my endocrinologist, he set me up for every 3 months to monitor my blood sugars, make sure that nothing is creeping back up. He also set me up with a nutritionist slash diabetic coach who made sure that I was continue to eat healthy. Just because I had the infusion and it has delayed the onset of type 1 doesn't mean I can go out and eat the chocolate bars and think everything is fine. So they wanted to make sure that I was still on track, trying to make healthy lifestyle choices as far as the food is concerned, and to constantly be mindful of stress and exercising and to keep myself as healthy as possible. So with that, I do meet with my diabetic coach slash nutritionist every 3 months. And sometimes if I need to speak to her sooner, she's available for me to chat with her, and she'll chime in for a little virtual appointment. So that's what I have been experiencing with my journey.
Thank you so much for sharing, Tanya. The next question. What are signs that stress might be affecting glucose or energy levels? I could have asked this myself.
Yeah, so I can take that one. What are signs that stress could be affecting glucose levels? Jennifer mentioned this during her presentation, the correlation between stress and cortisol levels. And cortisol levels, or cortisol is a hormone, and sometimes we call it a stress hormone. But essentially, it's the hormone that's released when people are undergoing stress. And what we do know is that that increases your blood sugar level. So, and sometimes you can have those obvious stress, there's something that happened that's very stressful, but sometimes you can also have very subconscious stress that you might be going through subconsciously that can also have this mildly elevation of your blood sugar levels. So essentially, stress does increase your blood sugar level. That's why things such as meditation, understanding ways to decrease stress, and then sometimes there's social connection. Jennifer mentioned that family connection around food. Sometimes for other people it's faith-based. So things that are personalized that help to reduce your stress is very important, not only for type 1s, but really across the board, diabetes, period. And then even if you think about that progression from stage 1 to stage 3 or stage 2 to stage 3, as much as possible, those lifestyle interventions and stress reductions are also very important.
Great, thank you. And let's see, what's one small change that can make a meaningful impact after screening?
Yeah, so one small change, the person who asked the question, I'm not sure if there was anything particular that they were um, thinking about, but it really matters where you are in terms of what you would change. So, for example, if you have a high family history of autoimmunity or type 1 diabetes and you screen and you're negative, I will go back to those lifestyle changes that Jennifer recommended as a start. If you have a family history and then you screen positive, let's say those early stages, stage 1, I mentioned that that's not currently indicated for treatment. I would definitely still do those lifestyle changes that we spoke about earlier on, as well as learn about type 1 diabetes. Call your insurance and see, if you do eventually progress to stage 3, what that will look like for you. And then if you have stage 2, so if you screen and you have mildly elevated blood sugar levels and 2 autoantibodies present, so that's stage 2, then I'll definitely talk to your provider about Teplizumab. And Tanya is someone that has undergone that, so she can definitely share her experience. But that will be um, definitely a change that would be, I would say, important to at least investigate. So your question, essentially, I gave various answers depending on where you find yourself along the journey. So
Amazing.
Tanya, I want to follow up with the changes that happened with you after you were screened positive.
After I screened positive, I met with the endocrinologist, and basically there wasn't a lot of information that he provided at the time. I went right into, we have an infusion that we would like you to try, and that was the Tzield. And I said, sure, I want to do anything that I can possibly do to delay the onset of this disease. So he walked me through it and basically told me it was going to be a 14-day infusion consecutively. I had the option to do the infusion at home. Other people can have the option to go to an infusion center or at the doctor's office. But for me, my nurse came to my house. We did the infusion. There were some side effects that came with the infusion. The doctor monitored me every 3 days during the infusion, the 14-day infusion set. And the side effects really did get me. There were some really bad ones. Besides zapping out your energy and having your immune system go down to like you're always feeling run down as you had like flu-like symptoms. But once I overcame all that and the symptoms subsided, um, I think it was pretty well. I would always choose to do that again if I had the option. And I was glad that the early screening was done because if my doctor did not do this, then I might have easily slipped into stage 3 without even knowing because I never had any major symptoms except for increased thirst. That's all I had. So I was actually typed as a pre-diabetic type 2. So because of my family history, I was put in that category, which probably is the reason why I wasn't tested for type 1 way back when. But when he did decide to test me, which was last December, I'm very appreciative for that.
Yeah, and I would say that Tanya raised up an excellent point, which is initially you're diagnosed with type 2, or the thought was that you were type 2. And we're really beginning to see that more and more, where people who were diagnosed with type 2 eventually get antibodies checked and then realize that it's actually type 1. What we're used to seeing or the thought for type 1 back in the day, which is this is a childhood disease, we're really beginning to acknowledge the fact that that's not necessarily the case, and that you can be diagnosed with type 1 across multiple stages of life. So that awareness that, especially if there's a family history, or if there's some atypical signs or unusual signs when it comes to your diabetes, that checking these antibodies is a way to go. So if that's something that, there's questions, there's family history, or, your diabetes is not, um, there's some questions around it, or maybe you're just, your provider's trying to figure things out. I think testing is definitely something that should be considered.
Absolutely. And we have another question here. The changes of the style of eating you recommend, do you need to do when the test results is positive on stage 1 or stage 2?
So I would go ahead and answer, and then Jennifer, maybe you can follow up after me. But when it comes to lifestyle, the dietary changes around lifestyle, so far there are no strong evidence that actually prevents the diagnosis of type 1 diabetes. So if you remember, I talked about stage 1, stage 2, and stage 3. So if you go from no antibodies to the presence of antibodies, but what we call seroconversion, we don't have strong evidence that lifestyle changes that. However, with type 1 diabetes, so stage 1 or stage 2, there is some evidence that shows that with the exercise that Jennifer recommended, the changes in your food, that that can cause a delay into that clinical stage 3 type 1 diabetes. There are many, when it comes to lifestyle, and especially dietary changes, there are many options for you. Jennifer went through a few of them, but always talking to your, getting a referral to dietitian, I would say is always number one, because that's where you can really sit down, have a one-on-one discussion to see what's practical for you. And then Jennifer, I'll have you talk about how you'll assess people during your visits and how you make recommendations and make it personalized depending on their diagnosis and what they're trying to attain.
Yes, definitely. It can be overwhelming when you see all of these lifestyle changes, and if you feel like you aren't doing any of these, I know the feeling of overwhelm. So when I work with people that are at risk, which is mostly who I work with, they've either been diagnosed with prediabetes again, or are being screened for type 2 or type 1. I really help them look at, what are you already doing and how can we build upon your current habits? Or how can we begin to add in things, right? Instead of focusing on, you can't eat sweets, or you feel like you can't have desserts, or you can't eat your favorite foods. I have people really focus on the positive. What are things I can add into my lifestyle, whether it is the exercise piece or anything with the food that's going to benefit my overall health, right? And we know gut health is so important for so many other things, such as even cancer. So, why do we need to add in fiber, right? For so many other things, we look at what are some high fiber foods and how can we start incorporating these throughout our week? Or how do we get more variety of plants, right, to support our gut health and reduce inflammation? How do we incorporate a lot of these Mediterranean style dietary habits on a small scale so it doesn't seem overwhelming and we're not focused on the negative or what we can't do. I like to help people focus on what can we be doing. And then there's always room for things that we enjoy, right? That we feel like may not be part of the plan, but I always say if we're doing, 80%, 90% of what we need to do, we can enjoy ourselves the other percent.
Yeah, and Jennifer, you make an excellent point because I feel some people really feel that they're letting themselves down or family members down or even their dietitian or the providers when they don't do exactly what the plan is, right? So it's always important, as you mentioned, that even if it's 80%, any change towards the right direction is a huge benefit when it comes to your health. So that's a friendly reminder that I always give to my patients when it comes to changing those lifestyles.
Great. And I don't see any other questions in the chat, but I wanted to thank you all for your thoughtful questions and to our panel for the compassion and the expertise that you shared tonight. These insights really remind us that lifestyle isn't about control, it's about empowerment. So before we close, I want to thank our wonderful speakers, Dr. Buhari, to Jennifer Rollins, and Tanya McNeil for sharing their knowledge and perspectives tonight. And to all of you that joined us, thank you for taking the time to learn, connect, and engage in these important conversations. Every person here tonight represents a step towards greater awareness, community, and proactive care. So please take a few moments to complete the follow-up survey that will arrive in your inbox. Your feedback helps us to continue creating programs that meet your needs and interests. And we also hope that you join us for our next event in the type 1 diabetes screening, Living in Limbo. So that's navigating life in the early stages of type 1 diabetes. And that will be happening on January 13th at 12 noon Eastern Standard Time. So stay connected with DiabetesSisters.org and follow us on social media for event updates and resources and more stories from women living with diabetes. Thank you again for spending your evening with us. And remember, knowledge and connection and community are some of the most powerful tools that you have.